Well, Diane wanted the full court press, so she also wanted to fix her teeth. So Dr. Jordan Soll recommended veneers and a crown. Let's take a look at what happened.
When you leave today, the appearance of your teeth are going to be much nicer than how you started at the beginning of the day. This tooth is going to be an important tooth in your new smile. And what we have to do, because the tooth has been previously crowned and there was a post put inside it, we have to sort of work with what was there. And we're just sort of modifying things so that the existing post in the tooth will work with your new aesthetic restorations. So I'm going to spend some time to just rebuild things. She came to us because she wanted to just update her smile a little bit. She did not want a huge transformation, and she's opting for what a lot of people are referring to now as sort of age-related dentistry. They don't want bright white teeth, but some of the teeth are crooked, misaligned, not in proper position. So she wanted to clean up things a little bit. And in fact, when we looked at her smile, the teeth were sort of disappearing on the upper left side. Two front teeth weren't the same length. And so she wanted to just bring some symmetry to her smile. And so we decided to do something on a very conservative basis. And in fact, what we did is we just addressed the 4 top teeth and the 4 bottom teeth. And it looks great. Again, very important to make sure that we have everything captured in the impression so that Trevor, when he pours up in the model, he's able to find the finish lines and have the new restorations meet those finish lines clearly. Okay, Diane, so you all set? And open. A little bit of cold air. Stay open, please. We're going to try in your temporaries now. You all set?
I'm ready.
Here you go.
Oh, unbelievable. They really are. Oh, wow.
It was terrific. I mean, it was certainly, there were little points in there that were, I thought, oh my. But it was, overall, it was a great experience, both for the face and the teeth. It was wonderful.
Hi, Dr. Mulholland.
Diane, it's so good to see you again.
Yeah, good to see you as well.
Have a seat. I've got some great pictures to show you.
Oh, lovely.
There's been a tremendous rejuvenation, both in the eye area and the jawline. You feel you're looking natural,
yes,
but relaxed and refreshed.
Exactly.
Which was our goal.
Just incredible. Wow. Okay, so the teeth, you know, in the before shot, you don't really notice a lot going on with the teeth, but then you see the after and you think, wow, it really did make a difference. You used a combination of crowns and veneers.
We used a combination of crowns and veneers to really tidy things up.
What's the difference between the two?
Well, with a crown, think about a 360-degree coverage.
Okay.
There's full encapsulation of the existing tooth structure. With a veneer, think about a new face. So it's about 180 degree, just the new face.
So just like the front?
That's right.
All right. Now, you said that this was a very age-appropriate job that you did. And what do you mean by that?
Absolutely. Well, Diane had existing dental work, and so because we were just addressing the front 4 teeth on top and the bottom, we had to have the new restorations match color-wise, shape, contour. We didn't want them sort of standing out and arriving before the rest of her smile. We just want to sort of tuck everything in and just make it look great with the way her age is. We didn't want to sort of turn back the clock too much.
Okay, and you didn't want to give her, you know, what I call Denzel Washington teeth? They're all like perfect little chiclets, right? You wanted to make sure it looked like a woman her age would have these teeth.
We wanted to make it look like a woman who had just aged gracefully, and her teeth looked appropriate for her smile. Okay,
got it. When do you know when you should use a crown versus a veneer?
Well,
how do you know?
There's really 2 premises. One is how much do we have to recontour and reshape the tooth? Will a veneer do it? If not, then we may have to go to a crown. Also, how much previous destruction and fillings are in the existing tooth? If you have a tooth that has greater than 40 to 50% of existing fillings, then you know you have to go to a crown. As well, there may be an existing crown on her tooth, so you cannot take a crown off and put a veneer. You can only take a crown off and place a new crown.
We have a picture here of the before and after. How many teeth did you actually change?
So on the top, we changed the front 4, and on the bottom, we changed the front 4.
And what an incredible difference that makes. Can we talk a little bit about price, the difference between crowns and veneers?
Price is pretty well the same.
Okay.
There is a tremendous amount of effort either to make a crown or a veneer. It's at different stages of the process. Crowns are much easier to insert than a veneer is. A veneer, you have to be very, very patient, and it takes a little bit of time. So each one has its nuances, cost about the same.
How long are we talking about if you wanted to go in and get something like this done? How long does it take?
This case, quite interestingly, was done in about a day and a half. The first appointment was about 6 hours in length, and the second appointment was about 3 hours in length. And quite typically in our office, in between the two appointments, I'll have the patient meet with my aesthetic lab technician, Trevor Langchild. He is phenomenal. He mixes the colors.
Yeah.
He makes sure that the teeth really look like teeth, not like a bar of soap.
And can you eat in between these two procedures?
Absolutely.
You can?
At no time is the patient socially challenged. We make the temporaries, and they can go out to parties, and there's absolutely no problems in between the two appointments.
So I don't even think I need to ask, but Steve, how does she feel about her after? I mean, the difference between the before and after is just amazing. How's she feeling about the whole thing? Look at that. That is amazing. Yeah. And you were saying some of these, this was like 45 minutes.
It takes less than an hour to get that type of overall skin and face appearance. But again, if you look at the beautiful work that Jordan did, without the teeth, it's really missing that final component that's so important. And then hair and makeup. It all really comes together. Your whole show comes together in a synthesis of looking your best, really.
Trust me, I know a thing or two about hair and makeup. I would not be doing this show without it. How long are the crowns and veneers going to last? And do they take some maintenance?
Well, the maintenance they take is good home care.
Okay.
And seeing your dental hygienist on a regular basis. And it's really your dentist that should decide what is the proper interval, whether you should be seen every 3 months, every 6 months. And so really, if you maintain them well, crowns should go anywhere from 5 to 25 years.
Excellent. All right. Good work on both of your behalves, and I think that it's good information for people out there who are looking for an easy way to get a nice freshen up. So thanks for that. We're going to take a quick break. Stay with us. Makeover Matters.